The following training is sponsored by the Niagara Library System. We serve our member libraries in Niagara, Orleans, and Genesee counties. Please visit your local library homepage and use your library card to get access to streaming videos, downloadable music, audiobooks, ebooks, and even more from the comfort of your own home. Thank you. Hello. Here we are back again talking about patient portals. Now, everything that we are talking about as far as if you want to apply for any kind of veterans benefit, Social Security, if you want to renew your driver's license, if you want to do anything like that, all of that involves having an email. So what we're going to do is I'm going to go quickly over what a patient portal is, and then we're going to talk quickly about email as well. And you will see in the middle why I'm doing what I'm doing. So hang with me here, okay? I went to Medline Plus, which is a website that's run by the U.S. National Library of Medicine, and it has an encyclopedia of medical terms, and it has an excellent article on patient portals. Basically, it says here, a patient portal is a website for your personal health care. This online tool helps you to keep track of your healthcare provider visits, test results, billing, prescriptions, and so on. You can also email your provider questions through the portal. Now, when they say email provider questions through the portal, a patient portal is a more secure piece of software. Your doctor's office, your healthcare provider is providing the patient portal, and they pay a lot of money to companies to keep these portals secure, because that is really important for not only just for privacy's sake, but for lawsuits or anything else. So if you email through the portal, that is literally different. It's literally more secure than just sending out an email on the fly, all right? Portals are meant to be pieces of software that are online. They're websites that have multiple security layers for you and for your healthcare provider. Many providers now offer patient portals. For access, you will need to set up an account. We'll talk about that in a minute. The service is free. A password is used so that all of your information is private and secure for you. The article goes on to say, with a patient portal, you can make appointments that are non-urgent. You can request referrals, refill prescriptions, check benefits, update insurance or contact information, make payments to your provider's office, complete forms, and ask questions through a secure email. You may also be able to view test results, view visit summaries, your medical history, including allergies, immunizations, and medicines. You can find patient education articles that are more reliable than something you might just Google or search the internet for, and who knows who is providing you the information. So the patient education articles that are provided through a portal are more reliable. Okay. And some portals even offer e-visits. It's like a house call for minor issues such as a small wound or a rash. You can get sometimes diagnosis and treatment options online. This saves you a trip to the provider's office. Now, I don't know where they got this, and this, let me scroll up. It says e-visits cost around $30. I don't know where Linda Vorovic got this. She's the one who wrote the article for Medline Plus, so I don't know, but that's what she, said in the article. These are, of course, very good. This is very general outlines of what portals can do, what they may do. And in each case I found on the internet, there were these important instructions. And I took this screenshot that I'm going to show you right from the Lexington Medical Center frequently asked questions. How do I get access to a patient portal? Your healthcare providers can provide you with instructions to set up your account. Let me just stop there. Your provider must provide you instructions with how to set up a patient portal account. It's usually some sort of a paper. It's maybe a little trifold brochure, but there are definitely instructions. There are particular websites to go to because each provider may use a different type of software. The software security is absolutely a must. If you are going to try this, you must go to your doctor. You must ask your doctor's office, your healthcare provider, where do I go for this? And then follow the instructions that they give you exactly. Your healthcare provider can provide you with the instructions to set up your account. There may be a couple of steps involved, including creating a secure password to make sure that only you have access to your health information. And once your account is set up, you'll be ready to conveniently access your health information and medical records. Now, again, this is vital. Each doctor or medical center or hospital or office may use, again, a different type of software. I sound like a broken record, but it's true. The office is responsible to provide you with instructions to create a secure account so that you know how to log in and you know what to do. Now, as an aside, so going away from the portal, right? Email is still, let me just highlight this. Email is still the most important thing you can have to access these types of services. Knowing your own username and password, and this is an email address that you would create, it's yours, it is confidential, but it is not as secure as what would be done through a patient portal. I have email addresses. I've had email addresses for years, and I'm going to do a real quick rundown through this video on how to sign up. I picked Gmail for Google. You can pick Yahoo. You can have a Microsoft account. You can have any account you like. They're all very similar in how you sign up for them. I'm going to run through Google real quick. Here's a very fast rundown on getting an email account, and I have other videos on this, and I have much longer videos if you're interested. Pick a service for the email. In this case, I'm going to use Google. I'm going to go to the Google homepage, right to the page, www.google.com. I am going to click the sign in button. You can see it's in blue, and it is in the top right corner of the web page. As soon as I click sign in, I am going to get this little screen here in the middle where it says I can sign in. I can use my existing Google account, which we don't have. We're going to go right down here to where it says create account. And we are going to create an account for personal use. When you click create account, it'll say for my personal use or for business use. For my personal use, and when you click that, you fill in this form right here. This is it. This is this little tiny form right here. Fill in the form on the screen and write down your username and password. Write it down. Don't lose where you wrote it. If you have kids or grandkids or someone you trust to keep it for you, I honestly, someone do that, okay? This email address is going to be a way that, for example, if you forget your patient portal password, this email will be a way to reset that password, all right? So it's absolutely vital you know what your username, you can see this here, your username at gmail.com, and then you have to create your own password. Passwords must, and it says it right here, must use 8 or more characters with a mix of letters, numbers, and symbols. You've got to have all that in there to create a secure password sign-in. Now, as soon as you click next, here's the interesting part. You must, right here on page or number 6, you must have a telephone number to verify that you are the one who wants the account. There is no getting around this. Now, Google will robocall a landline or a mobile phone. You don't have to have a mobile phone. You don't have to get a text message. Google will robocall a landline, and tell you a one-time use code that's usually 6 to 8 digits long. So for example, you say to Google, yes, I want this account. It'll say, we want to verify, put in a phone number. Let's say I put in my home phone number. Well, I can wait anywhere from 1 to 2 minutes and my phone will ring. And let me do the old-fashioned here. I go and I pick up the phone and I say, hello, and it will say to me something like, your Google verification code is 24689 and that's it. And what I would do is I would write that down, 24689, and I would come back to the computer and type that into the boxes that would be on the computer waiting for that verification code. I only need it one time. It's not something I have to keep or anything else. I only encourage you to write it down to make sure you get it right. There is no bypassing this step in the setup of your new account. You have to get that call and you have to get that verification code one way or the other, either by text or by phone, and you have to enter that verification code. Once you do that, you're going to sign in and you'll actually see then instead of it saying that big blue sign in button, it'll have your initial at the top right corner. And if you click on the little link that says Gmail there, you will actually see part of your inbox then. And as soon as you sign into Google, you will get 3 new emails from Google welcoming you in, showing you some new features, and that kind of stuff. So usually you get 3 new emails as soon as you sign into your Google account. And I have a lot more videos, well, a few other videos and some longer videos on how to create an email account. For this video, I'm going to stop here. I do want to, again, to end on the idea of the patient portal. A patient portal is a particular piece of software that your healthcare provider pays a lot of money for to make secure so that you can use your newly created email to log into the patient portal account, follow the steps that the doctor's office, that your healthcare provider gives you, and create your secure password for the portal. And then once your account is set up, you are able then to conveniently access your information and medical records. I hope this was helpful. Talk to your healthcare provider, and we'll see you in the next video. Thanks. Bye now.